50-year-old Brian Thompson, the
CEO of UnitedHealthcare, which is the largest healthcare company in the country, he was shot
and killed in what
Luigi, do it. And it's completely out of touch. And it's an insult to the intelligence of the American people and the lived experience.
As UnitedHealthcare has been thrust into the spotlight and questionable practices have been revealed, the narrative seems to get exponentially worse. There's so many reasons why. Not only do they turn a profit from denying and defending against patient claims, they simultaneously do this on the physician side as well. And of course they can. They are America's largest insurer. Not only that, they also employ the most doctors in the United States. Who's going to stop them? They have immense power. So today we'll look at the underbelly that is United Healthcare Insurance.
I don't think he did it. But you know what? Even if he did do it, you know what I mean?
Hi, I'm Dr. Dre, board certified in, you know the topic, United Health. And we're going to look at their origins, their profit model, and the way they've integrated themselves in the American healthcare system. One of the most shocking things I'm going to reveal is how they're responsible and how they make a profit from doctors on payday loans. Sounds crazy, and yes, we will get to it. Now, let's take a deep dive into this monstrous company. Now, before we get into anything, I want to roughly explain how insurance works. Health insurance is supposed to be a financial safety net for medical expenses. You pay a regular fee, and the insurance company, in return, supposedly, they're supposed to help you cover the cost of these medical expenses as they come up. Now, these costs could be doctor visits, they could be hospital stays, they can be medical procedures, or they could be prescription drugs. In the most benevolent way, they make a profit by insuring a large group of people. And the reason this works is not everyone will be sick at the exact same time, and not everyone will incur a medical expense at the same time. And again, by having a large group of people, they basically, the risk that is there is spread. Now, in a non-benevolent way, they make profit by denial of services, denial of coverage, denial of paying the full bill, paying a fraction of somebody's bill. That's a profit. They make a profit by paying less for doctors' services, or they pay less for doctor reimbursement for a service. And also, if you pass away, guess what? Of course, that is profit. So you can see how there's many ways an insurance company can make a profit.
I've been really keeping up on my insurance payments lately.
Yeah. Hey, great job with that, by the way. Keep it up. Keep that up.
Thanks. And the thing is, I haven't really needed my insurance lately, so...
You're welcome.
Right. So I was wondering, like, since I haven't really needed my insurance, maybe I can get a little bit back on what I've been paying, kind of like how tax returns work, you know what I mean?
For what?
I don't know, like a little treat or something, you know?
A little treat?
Yeah, a little treat.
Oh, no. No, absolutely not. Oh, man, you are a funny dude.
Well, let's go into the main topic, which is United Healthcare, and how did they become the behemoth that they are? So let's talk about their origins. It was founded in 1977 with the acquisition of a smaller group, Charter Medical Incorporated. I want you to remember that name because we're going to come back to it. And in general, the rapid growth of United Healthcare was attributed to their early adaptation of the HMO, which is a model that became very popular in the 80s. So sidebar, what is an HMO? Otherwise known as a health maintenance organization. In short, it's an insurance group or club that you're locked into. It's a closed system. And this group, or the HMO, dictates or designates what physicians you can see, what specialists you can see, and what hospitals you can go to. The overall strategy of an HMO is to save you costs, save the patient costs. Now, again, that's the overall strategy. However, it also can save the corporation a lot of cost. Again, they have certain physicians you're allowed to see. Maybe they have a deal with those physicians. Maybe they're paying them less. Again, you're going to certain hospitals. Maybe they have a deal with the hospital and they're paying less for that. But overall, you're supposed to save costs. And generally speaking, the way a HMO works is through a focus on preventative healthcare. So they spend a lot on preventative healthcare and early intervention of anything that comes up. Okay, so back to UnitedHealthcare. Again, I said they were one of the early adopters of this model. Now, part of that was due to the fact that HMOs were being subsidized by the government, and the other was because they were able to acquire other HMOs. And besides acquiring other HMOs, they were able to acquire physician groups and, yes, other general insurers. And through the acquisition of all these groups, they were able to become one of the US's largest insurers. And moreover, not just are they the largest insurer, they also employ the most doctors in the United States.
You got an HMO, right?
Yeah.
Well, there's your answer. I mean, HMOs pay their doctors not to test. That's their way of keeping costs down. All right, let's say Mike did need additional testing, and insurance says they won't cover them. The doctor keeps his mouth shut, and come Christmas, the HMO sends the doctor a fat-ass bonus check.
Is that true?
Possible. Not likely, but possible.
You telling me that these doctors may have known what was wrong with my son and they could have treated him all along?
Who knows? I don't know, John.
Don't take this personal, Doc. Y'all a bunch of goddamn crooks.
So remember I hinted at the shady underbelly about UnitedHealthcare. Well, you'll understand more when I fill in the gaps of the history. Because when I told the history, I missed out a key player. But you'll soon understand. So remember when I talked about Charter Med Incorporated in 1974? Well, it was a physician group. They saw patients. And the CEO of that was a gentleman called Richard Burke. That same Richard Burke was also the CEO of UnitedHealthcare. He founded it in 1977. So essentially, he combined both organizations and he was the CEO of two companies. So you can understand how lucrative it was when he was seeing patients on one side and then had an insurance arm over the whole organization. It goes deeper. Remember when I talked about HMOs and how they became popular in between 1970 and 1980? Well, there was a think tank that helped create the Health Maintenance Organization Act. And on this think tank that helped push this act was a gentleman also called Richard Burke. And again, this organization helped to come up with the idea for the government to fund the HMOs, making them profitable, making them cheaper to run. Again, that was with help of Richard Burke. The story of Richard Burke gets even crazier. So when I grew up, this sounds like a total sidebar, and it is. I grew up in a small Canadian city called Winnipeg. Not a lot to this city, especially in the 90s, but the one thing we loved was the Winnipeg Jets.
But the national anthem was more like a requiem for the soon-to-be-departed Winnipeg Jets. They made their final appearance in Vancouver as a Canadian team, much to the sorrow of many Manitobans.
So is your heart breaking?
Oh, very much so. Yeah, it's pretty tough. Pretty tough to see them leave.
It'll never be the same.
Well, the Winnipeg Jets, when I grew up, left and moved to Arizona. Do you want to know who caused them to move? Believe it or not, it was Richard Burke. This guy's been torturing me for my entire life. Yes, and again, it gets crazier. Richard Burke also became the CEO of a physician group, so a group that sees patients. He was part of a non-profit organization called Physician Health Plan. Can you guess what happened next? Well, Physician Health Plan, guided by the CEO, Richard Burke, hired UnitedHealthcare to provide insurance for them. And what happened? Well, denials, delays, and defenses against patients and patient claims. Essentially, he ran a nonprofit physician organization and an insurance arm on top of that. And essentially, there was multiple lawsuits because not only were patients being denied on one side, the physicians were being squeezed on the other. And their lawsuits basically stated that they were being underpaid and mistreated. So essentially, he was making money on both sides of these organizations. Essentially, this was foreshadowing to how the company would continue.
Nothing like this has ever happened. So I think it took us all by surprise. I will say, though, I'm not shocked when you stop to think about the rage that people have about health insurance companies in this country. They know that these companies are in the business to make money, and they've erected barriers that make it increasingly difficult for us to get the care that we need.
And this is major, major foreshadowing for what happened again and again. And there's several examples. There's a group called Team Health, a physician group, which successfully sued UnitedHealthcare in 2021 for underpayment of physician services. And this was here in Las Vegas, where I now live. And they won $63 million in damages for underpayment of emergency services. In 2022, Team Health, which was also in Florida, won $10 million against UnitedHealthcare, again for underpayment, and the list goes on. Another group, Envision Healthcare, won $91 million for emergency services in 2023. MedAx, another staffing agency, physician staffing agency, won $65 million in emergency services. I'm going to keep going. Emergency care specialist, $24.6 million. And I found 3 other active lawsuits against UnitedHealthcare currently. You know, and as a resident and as a medical student, I would hear some of the older doctors complain. And they're saying stuff like, they keep squeezing us. They keep squeezing us. And the more research I do, the more true it becomes. And here's where I bring up the payday loans that I discussed early, and it's pretty gross. So as a physician, again, you have services and you bill the insurance. So let's say you perform a service and that service is $30K. So send a bill to the insurance company for $30K. Insurance company says, okay, here's $10K. We're going to look into this claim that you're making. And you're out of that money and you're waiting. And sometimes physicians can wait months or years. So a practice is not making the money that they need, maybe to keep the lights on, that kind of thing. Well, guess what UnitedHealthcare does? They have a group that will lend a physician some money under the organization called Optimum, which is part of UnitedHealthcare. So again, we're giving partial payment, we're holding a payment, but you can get a loan for the remainder. So let's say again, you have $30K that's owed to you. They give you 10. Well, they'll give you a loan for $20K for the amount that you say you are owed while they look over the claim. Now maybe they give you another 10, so now they've given you 20, but they're saying the other 10 it's not yours. Guess what? You took it a loan, so you know you have to pay it back, and there's interest on top of that. And that's another way they're squeezing physicians on both ends. Now, when I'm sort of explaining insurance to other people, they make claims like, well, insurance wouldn't cost so much if doctors weren't charging so much. And I want to tell you a couple things. One, doctors can only charge so much, and it's pretty static of what a physician can charge. It's in a model, and the doctor cannot make up his own payment. Another thing is, if you look at the insurance cost, one of the things, yes, they do pay physicians, but the cost they pay to physicians is between 10 and 15%, which is around the same as their marketing budget. So no, the physician's fee is generally fixed and not part of the structure, or is not causing the structure to hurt people. Now back to the patient side of things. Remember, they make a profit by denials. That's really where the revenue comes from. Initially, denials were a small part of the revenue when insurance companies were first starting out. It just wasn't economical for them to go through each claim and challenge it. But they became smart. They began to employ physicians and nurses that could handle claims. The next thing they did was then they started using computer modeling to help predict which claims they should deny. And finally, they used AI. Now, again, there's different ways or different percentages. Now, there's different percentages of denials. But guess what? UnitedHealthcare leads the pack with some 30% of denials of claims. And again, denials equal profits. In conclusion, I can only highlight how the system operates. It is clear that the American healthcare system, and more specifically, the insurance system, has immense problems. The influence of these powerful entities, like UnitedHealthcare, coupled with their profit-driven strategies, causes a lot of havoc on the system and does hurt people. And the only way this will change is by reshaping the industry. Now, it's going to take a power shift, and it's going to take people like you and me. And it's going to take many years. But hopefully, in the end, we will prevail. And until next time, stay safe.